Hello everyone, Cat Pink, Nurse Cat Pink here coming to you, sitting in the sun because I missed the sun. I'm a Cali girl, I'm back in Cali in the Bay Area, and I missed California because I was in Connecticut for 3 years studying at Yale to become a nurse practitioner. Once I became a women's health nurse practitioner after working as a lactation consultant in hospitals, in homes, in clinics for pediatricians, and studying midwifery. I'm not a midwife, but I studied midwifery for many years there and studied nursing and advanced practice nursing, which is kind of like studying to become a doctor, but you don't do surgery. I did do some surgery there with doctors, but that's not what nurse practitioners do on a regular basis for the most part. And then I moved to Oregon, to Portland, Oregon, and I worked there for 5 years as a nurse practitioner and did some work as a full-time nursing faculty, teaching nursing as well. So now I'm finally back in the Bay Area and so excited to be back in the sun. My bones missed the vitamin D. So today I thought I would talk to you about something I woke up really inspired to share, which it has to do with bleeding. So something that I think it's really interesting that no matter where you come from, what culture you come from, no matter how you've grown up, no matter who you are, it seems like this one piece of information that isn't widely distributed even to doctors, and that a lot of doctors don't know unless they're in women's health, is that it's okay not to bleed if it's because of your birth control. Like, it's healthy not to bleed. It's actually, for some people, healthier not to bleed. There's a really common misconception that even my own dermatologist who works for an Ivy League institution, smart doctor who knows her, you know what, even she questioned the fact that I had been taking birth control and hadn't had a period in a while. And I was thinking, wow, this is something my patients always ask me, and well, they don't even ask, they express concern about. It's called continuous cycling or extended cycling, where you take birth control for an extra long amount of time to not get a period. But a lot of patients don't even know to ask about it, and patients, doctors, ranging from people that maybe have only had a high school education, or maybe they've also had college, but even ranging up to people that have been in school, graduate school, medical school for like years and years and years. It's just something that people don't know. And you may say, okay, Nurse Cat Pink, you're telling me it's okay not to bleed. If I were to take my birth control for, let's say, 3 months straight, never take the placebo week, never take that week of pills or the skipped week of pills, which makes me have my period. You say that, but that doesn't make sense. It's not logical. And I agree with you that it doesn't make sense when you think about it at first. But there's a really basic, easy answer regarding the physiology or the way our bodies work to explain that. So the reason that people who have a uterus have bleeding every month when they're not on hormones, they have that normal natural bleeding, the period as we call it, that happens because the hormones in between the cycles of periods, the hormones make it so that this lining inside of our uterus, it starts to build up, it gets thicker. That's normal and that's okay. After a couple of weeks, there's a point in our body where there's a trigger for the hormones to shift. And when the hormones shift every month, that's when we get PMS symptoms, the breast tenderness, maybe some migraines, moodiness. Some people don't have PMS symptoms, lucky. Or it does change throughout our lives as well. Sometimes we have them, sometimes we don't, depending on where we're at in life. But that triggers our body to then recognize that it's time to bleed. And then these tiny little blood supplying, to simplify a description, kind of like veins, arteries that are a part of that blood buildup, that tissue, bloody tissue buildup inside the uterus before our period. It triggers it to start spasming, which is kind of part of the pain of your period cramps, to spasm so that that tissue can be gotten rid of, and then it sloughs off. So that's the period that you see, the bleeding. It comes out in the mucus and tissue. So if you see some clumps, or it looks almost like like, oh my gosh, there's kind of like some skin in it or something. It's tissue, and the blood's getting caught in the tissue and the mucus. That's normal, that's okay. And that's what's being shed every month. That's the period. For some people, it's a little bit. For some people, it's a whole lot. Some people build up more lining in between periods. Some people don't build up as much. That variation is okay. It just depends on the individual. What's a way that we can control that lining from building up in the first place? By taking birth control, which suppresses the hormones that even build it up in the first place. So to be clear, when you're taking birth control, if your doctor recommends or your midwife recommends taking the birth control, or for example, using a hormonal IUD for more than a month straight, what that's doing is it's stopping the hormones that even build up that lining in the first place. So it makes it so there's nothing there to even shed. There's no tissue or blood buildup. There's no lining in the uterus when you take. It usually has to be at least a couple of months for the body to get used to it, to the point where it's not building up. Therefore, you're not needing to get rid of it. But trust me, if your body builds up lining, it's going to get rid of it, because everyone who thinks it's normal and natural to get rid of that lining, for the uterus to get rid of that lining, is 100% correct. It needs to be gotten rid of. The nice thing about taking birth control pills, for example, if you're someone who misses pills and the placebo week messes you up, a memory tool is just always taking the pill. Or maybe you have PMS symptoms you want to control. That's the most common reason for continuously taking the pills. So that you made that plan with your doctor or midwife to do that. Or maybe you have the hormonal IUD. So once that's in place for at least a couple of months, the cool thing is your body never builds up that lining. So absolutely 100% it's normal and natural, and your body needs to get rid of any lining that's building up in the uterus, especially if it's a lot. But one thing that's not discussed in medicine a lot, and one thing that I think is not a part of modern American culture, is to trust our bodies. Our bodies are extremely reliable, and a tricky thing here is that a lot of us have grown up being taught to fear our bodies, being taught, whether that be through traumatic interactions growing up with friends, family members, peers, society, especially if you're a woman or gender minority. We experience these things where we learn to be afraid of our body, we learn to doubt our body. I think that's true for everybody growing up in the United States these days, but definitely especially much more so for women and people of gender minorities, like trans folks, non-binary folks. That's what the term gender minority is what I'm referring to. And then, there's the variation on your specific culture, different races, ethnicities, places that you're from. You grew up in a possibly a family or environment that was additionally different, and maybe you were spared that fear of the body or ideas about the body, or maybe they were enhanced for you. But we absolutely can trust our bodies to give birth, and that we can trust that our bodies will get rid of blood that it doesn't need. And at the same time, nature does not always comply with what we want in our lives, right? So something that's natural I'm switching to a slightly different topic, but it's related. What's natural is to get sick, right? What's a natural process that happens in nature when we don't interfere with it medically? A quote unquote natural process would be for someone to get a virus, and then that virus hurts their liver or their kidneys, and their liver or kidneys stop working so great. And then when the body clears that virus, there could be permanent damage to the organs. I'm using an extreme example, which usually doesn't happen in healthy individuals, but that's quote unquote natural. So I use that to point out that how we use the term natural in our society, it often is supposed to infer something is good, normal, or better, right? When we say, well, that's not natural for my body, or it's not natural for me to skip periods. You could say that, but if we're going to use the term nature in that way, I want us to think about what nature means, what's natural. Something that's natural is to die. Something that's natural what nature has caused throughout the history of humanity is for women to be at high risk of dying in childbirth. Usually from a hemorrhage is the biggest cause. That's nature. But unless we medically intervene, like if we medically intervene, like if we give a medicine right after birth to make the uterus start clamping down and closing off the little blood supply areas in the uterus, like with Pitocin or other medications that can be used. If we don't interfere with nature in that easy, cheap, quick interference that we do across the world to keep women from dying in childbirth, then bad stuff happens. You lose a mom, an aunt, a sister at a young age, right? But it's natural. So I don't mean to be callous when it comes to illness, death, and disease. I 100% believe that illness, death, and disease are normal, natural, and when they happen in a way where it needs to be embraced, I think it's healthy for us to emotionally, mentally, and spiritually embrace it. I'm not saying that I've done that in the past. It's hard, it's painful, it's suffering, but it's part of that natural process. And I'm bringing this all up more to point out how we have these easy, quick, low risk interventions that can prevent huge suffering, like the loss of a woman's life in childbirth. Now that baby can't, like hypothetically, let's think of someone who has no access to medical care, formula, etc., like has been throughout the history of time with humanity. If that mom dies, now that baby can't eat. Maybe the baby dies if there's no one to take care of it. Like, and it's an extreme example, but it's a symbol of, yes, it's natural for her to die if there's no medical interventions done, if she doesn't get a blood transfusion and Pitocin and the things that make her uterus stop bleeding, given IV fluids, that type of thing. But it's suffering, and it's suffering that doesn't just impact that person, it impacts many people. And it can even impact the survival of a society or a culture or a tribe. So there's things that we can do in women's health that are quick and easy and low risk, and that can unnaturally help that woman to survive, whether that be mere physical survival all the way up to surviving and thriving in a modern day socioeconomic culture in the United States, where a woman's like an executive and she knows that she gets bad PMS and is rendered in extreme pain whenever she has the day before her period every month. This woman can't function to her top ability at work in her executive role if she continues to have this period pain. So we can intervene and stop it by her taking continuous birth control pills. So taking that hormonal pill every day for more than just 3 weeks, for example, for 3 months or even longer. There's people that will take it without a break for the withdrawal bleed, aka period. They'll take it up to a year, sometimes even longer. And yes, there are side effects with hormones and birth controls. Definitely talk to your care provider when you're starting it if you feel like you don't have all the information yet about that. I'm sure I'll make more videos about it. But especially when it comes to someone who's of reproductive age, so if you're between ages, let's say ages 15 and 40, so that's just the most common age range for people to take birth control pills. Your body is typically, this is generalizing, but typically your body's healthy enough, or even if you have diseases like diabetes type 2 or thyroid issue or other stuff that affects hormones and your vasculature and organs in your body, usually when you're like, let's say 40, you haven't encountered the complications of that yet, like the severe impact that it can have on all of your organs, your sight, your heart function. Like those diseases, if unmanaged and uncontrolled, can over time, over decades, impact the body in a way that makes it unsafe to have hormones like birth control for some people. But luckily it's easy to make a broad sweeping generalization to say, even if you have one chronic disease or multiple chronic disease or conditions, it's usually going to be safer for you to take birth control, even on an extended cycle for months and months and months with no break, than it would be for you to not, especially if you're heterosexually active and at risk of an unwanted, unplanned pregnancy. Because the risk of birth control can be similar to the risks that people have to their health in pregnancy, but to a lesser degree with the birth control. It's far less hormonal stimulation than what happens in pregnancy. It's another topic for another day, another video, but it's generally safer to take it than not. And that's just even aside from the whole bleeding issue. So something that shocks my patients, and I'm talking folks that are like 14 and like haven't even started high school yet, or they're just starting high school, all the way up to your 35-year-old, 2 master's degrees, educated professional. Women are continuously shocked when I share this point of like, it's safe for you to not get your periods. And it all has to do with that lining of the uterus, like how the hormonal IUD and other birth control methods that I haven't even mentioned yet, what they do is they prevent the uterus from building up lining. So you might ask, well, why do people worry about a buildup of lining in the uterus? Like, why would a doctor even say, make sure you talk to your gynecologist about you not having a period for a long time because of your birth control? Well, if it's because of the birth control, they're imagining the lining in your uterus getting thicker, which isn't the case. That's not what's happening with birth control, but that's what they're imagining. And they're thinking cancer. That leads to cancer. And they're right, because if you have lining sitting in your uterus for a long time, that's building, we do know that that's a risk factor for endometrial carcinoma, uterine cancer, basically a cancer growing in the uterus. However, again, we can trust our bodies to get rid of this blood. When is a time where we might not have quite as much trust for our bodies to be able to get rid of this blood that's built up? A big thing is if you're not taking birth control, then I would worry about it. So if you're not having periods and it's not because of birth control, there's some type of internal hormonal problem going on in your body, which is more dangerous than the safe external hormone controlling the hormones in your body. I'm trying to think of a good analogy. When I think of one, I'll post it, but there's a difference between something else outside of your body controlling your hormones versus internal. And I'm just thinking of that example of death being natural, right? Like it's counterintuitive when we're thinking, well, shouldn't my own hormonal issue be more natural, therefore less harmful? It's actually the opposite. So, for example, for people that have women that have metabolic disorders, PCOS, their hormones are internally dysregulated. Can be internally messed up. And if they're not getting periods and it's not due to birth control, it's because their body's just not giving them periods. Over time, over many months and many years, these women are at higher risk of uterine cancer. One way that we actually prevent them from getting uterine cancer is by giving birth control or an IUD with hormone that regulates their cycle. That actually is a lot safer. So even if I had a person with PCOS, let's say a 35-year-old gal who came to me and she had PCOS, she hardly ever had periods for the first, let's say for 10 years, from age 20 to 30, she hardly ever had periods. And it's not because she took birth control. Like, let's say she's on no medications, has never taken medications, but really rarely, like once a year or twice a year, has periods. I would put that person on birth control so that we make sure that person is not just randomly in her body not building up the lining and then just not shedding it. We want to bring in the extra hormone to help her body actually not build up that lining at all. And hormones are really complicated. That's why we have doctors specializing in just hormones, endocrinologists. But when it comes to gynecology, so women's health, like or reproductive uterus, vagina health, and endocrinology, which is hormone health, a lot of people fall through the cracks with these two, because there's some conditions where gynecologists say, oh, that's kind of like, once we bring in thyroid and diabetes and additional, like maybe trans care into the mix, and we're talking about your body parts, maybe you should talk to endocrinology. And endocrinology will say, hey, I can help you manage the hormone stuff, but now you're telling me you have this bleeding concern. Yeah, you should talk to gynecology. And there's people that can feel put back and forth and kind of fall through the crack in the middle. And I'm trying to speak to you. I'm trying to help out there. I'm not an endocrinologist, but I love talking about hormone stuff and that integration of gender and hormone. So another reason why one should be concerned that the lining in their uterus could be building up in a way that could cause cancer, and that they could not trust that their body would just get rid of it and they'd be okay. Women who are post-menopause. So usually this is after age 50. So people who are age 50 and up, especially if they've gone 1 year with no bleeding after age 50, that's a pretty good indicator of menopause if there's nothing else going on. So like if you had an IUD in place or something and you already weren't having periods, obviously we can't rely on that lack of periods to tell us you've been through menopause. But if someone was having regular monthly periods and then they slowly tapered off over time and then they had a full year with no bleeding and there's no hormones on board, that's safe to assume that person went through menopause. So if that person has gone through menopause, they haven't had bleeding. Some people, it's not common, but some people, their uterus will build up lining for a variety of reasons. And you know how I said it's natural for the body to try to get rid of that lining? For those women, many of them at some point, their body is going to try to get rid of that lining. The uterus is going to try to remember how to expel blood that's built up, and a little bit of blood will come out eventually. And that's a warning flag to that person to go to their doctor right away. So if they've had no periods for a year and they're postmenopausal, for them, if that woman were to come to me and say, hey Kat, I'm 53 years old, I haven't had a period in a couple of years, and you know what, I had my period today, it's the weirdest thing. A red flag would go off and I would say that's not your period. Uterine lining has built up and it's not supposed to do that after menopause. It's supposed to stay really thin to the point where it doesn't even need to be shed. So if it's getting thick enough for it to come out, that's a problem. That's a cancer risk. And then that person would need testing for cancer quickly. So those are a few things about, sorry, I'm playing with a little hair tie here. I hope it's not too distracting. Those are a few things about like how it's, the term about it not being natural to not have a period. I would say, sure, we could say it's not natural, but there's many things that are not quote unquote natural that we want as humans, that we want for avoiding suffering, avoiding death, illness, and disease. And ultimately it comes down to a personal decision. Like, I'm not making this video an attempt to convince anyone to take birth control by any means. I just want people who have had that option in the back of their mind where they're thinking, well, I would take birth control, but they're thinking like, that's not good for me. And then a lot of times you don't get that time with your doctor or nurse practitioner or midwife to really dive into this topic like you and I are right now. So if you were ever considering it, or if a health provider of yours has ever recommended it, and you didn't get the time to ask them questions about concerns of the lining building up or not getting a period, hopefully this is just added to your database of information that you can use to make truly informed, well-informed decisions around what type of pregnancy prevention or PMS control method or PCOS control method that you like. The cool thing about birth control, and I do think it's awesome when people want it, and especially when they need it for symptom control, it's so cool because birth control pills or other types of birth control can treat like 40 other conditions. It's not just for pregnancy prevention. That's why I often don't even use the word contraception, which means against pregnancy. I don't even use that word when I'm in the clinic with my patients, because to me it's not an accurate, it reduces the kind of the value of birth control in my mind, because we use it to treat premenstrual migraine headaches. Like if you don't get your period, or even if if you still get the withdrawal bleed every month, if we regulate your cycle with birth control pills, it's usually less of a crazy fluctuation with your own hormones. So therefore, like the estrogen withdrawal, which causes PMS symptoms, is often less. Now, everyone's different, but that's the generalization. It's used to treat, like I said, various PMS symptoms, but anything ranging from acne to extreme breast tenderness I mean, there's just so many things I can think of beyond pregnancy prevention that we use it for. So you don't have to be heterosexually active to need birth control. If you're, like, let's say you're a woman in a relationship with a woman and you both have body parts that you two cannot get pregnant on your own, that's not going to happen, biologically impossible. If that's the case, you absolutely still have the right to access an IUD or other type of birth control, contraception to treat your PMS symptoms, and your insurance should cover that. So no doctor or healthcare provider or insurance company should ever ask you deep questions about your sexuality or sexual practices in order to qualify you for coverage of a certain type of birth control. Not to say that they shouldn't ask you, because it's good to get to know your patient. Like a doctor or midwife or nurse, they should get to know the patient's sexual practices to a point where that you're comfortable with, of course, in order to identify what you may be at risk for in a way that maybe you didn't think about, that this person knows that they can help you prevent. So that's the reason why, like, when you have a gynecology visit or any type of visit as a younger person, you are asked questions about, or should be asked questions about, sexual practices, preferences, that type of thing. Not in an in-depth probing, like they seem like they're curious way, but in a, like, the doctor or nurse explains, hey, I almost spilled my coffee. Hey, I ask all my patients, like, who they have sex with, what body parts those people have, and how many partners they've had in the 6 months, because it helps me get to know the needs that you have around preventing illness. So are you comfortable answering these questions? So it should be posed like that. It shouldn't be like someone's grilling you about, well, how do you have sex that way? What do you mean your partner's a guy but has a vagina? Like that type of, if it feels like that to you, that's not good. That's a sign you might want to get a different provider. But there should be a very professional clinical asking of these questions on a gynecology or a reproductive health visit around sexual health. So if you ever get the feeling that a provider is asking you like sexual history or sexual practice questions in order to get you approved for, like, clinically or insurance wise approved for a certain birth control method, you might want to ask them and just clarify, hi, what's the purpose of these questions? Or are you asking these to decide whether or not I should take this birth control method? And if they say yes, or if they indicate that that is the case, you might want to find a different provider, because people should have access to all types of hormonal treatment methods, in my clinical opinion. It's not just opinion, it's just kind of overall maximizing people's health and well-being, right? But that's just me. So it's actually good medical practice as well to give people IUDs, birth control, if they need it to not for pregnancy, but for a different person. That's just kind of like, you should have access to that per standard medical practice in the United States anyways. So that's about it. Another long video for me, and loving the sun, loving it. I hope everyone has a wonderful day. And if you have any questions, concerns, or words of encouragement, if you loved this video, definitely subscribe, hit the like button, and leave me a comment. I would love to make more videos based on questions people have. And yeah, that's about it. So Nurse Cat Pink signing off, and I hope this was helpful. Take care. Bye.